A pleasant day and welcome to another set of ECDB Flashcards Final Coaching. Our first flashcard is pure as gold. These are your purines. We have adenine, then we have guanine. Pure as gold. Next flashcard is cut the pie. C-U-T. This is for your pyrimidines. So these are your pyrimidines. We have cytosine, uracil, and thymine. Please take note, letter U, uracil, is only found in RNA. Next flashcard is a site-specific inhibitor for the electron transport chain complex 4, which is your cytochrome oxidase. So cyanide inhibits complex 4 of the electron transport chain or cytochrome oxidase. Another site-specific inhibitor of complex 4, which is cytochrome oxidase, is your carbon monoxide. So now we bring with us to the exam cyanide and carbon monoxide as the specific inhibitors of complex 4 of the electron transport chain or cytochrome oxidase. Now, complex 5 is also known as ATPase or ATP synthase. Complex 5 is inhibited by the drug oligomycin. Oligomycin specifically inhibits the FO fraction of your ATPase. Now, the double helix model for your DNA is known as the Watson and Crick model. This is the double helix or the double-stranded anti-parallel helical DNA. Watson and Crick model. Now take a look at this, wherein the ratio of your purines is equal to the ratio of your pyrimidines, wherein A would be paired with T, G, and C. So this is your Chargaff's rule, the 1:1 ratio. Now, the central dogma demonstrates that the genetic flow of information would be replication first, then transcription, then we have translation. So replication, transcription, and translation. This is the central dogma. Now, what cells of the pancreatic islets of Langerhans are responsible for producing glucagon? This is your alpha cells. The cells of the pancreatic islets responsible for producing glucagon, your alpha cells. Now, the beta cells of your islets of Langerhans will produce your insulin. The delta cells will produce somatostatin. Now, please don't forget your endocrine organs will secrete hormones directly into the bloodstream compared to exocrine glands, which will produce or secrete hormones or chemical substances through ducts. Now look at this reaction, the first step in the utilization of glucose is phosphorylation. So a classic example in glycolysis is glucose will be phosphorylated into glucose 6-phosphate, and the enzyme that catalyzes this is your hexose kinase. Now, we have glucose 6-phosphate undergoing isomerization to become fructose 6-phosphate. Fructose 6-phosphate will be phosphorylated into fructose 1,6-bisphosphate, and this is catalyzed by the enzyme phosphofructokinase. The reaction of fructose 6 being phosphorylated into fructose 1,6 by PFK or phosphofructokinase, this is the rate-limiting step in glycolysis. So what is the rate-limiting enzyme in glycolysis? It is PFK or phosphofructokinase. The rate-limiting enzyme for glycolysis is phosphofructokinase. The rate-limiting enzyme for gluconeogenesis is fructose 1,6-biphosphate. So the rate-limiting enzyme for gluconeogenesis is fructose 1,6-biphosphate. The rate-limiting enzyme for glucose 6-phosphate dehydrogenase. This is involved in your pentose phosphate pathway. So your glucose 6-phosphate dehydrogenase, or your G6PD, is the rate-limiting enzyme for the pentose phosphate pathway or the hexose monophosphate shunt. The rate-limiting enzyme for cholesterol synthesis is HMG-CoA reductase. The rate-limiting enzyme for cholesterol synthesis is HMG-CoA reductase. Do not forget, this is the enzyme that is inhibited by your statins or your HMG-CoA reductase inhibitors. The rate-limiting enzyme for catecholamine synthesis is tyrosine hydroxylase. The rate-limiting enzyme for catecholamine synthesis is tyrosine hydroxylase. Now, please don't forget, tyrosine arises from phenylalanine. Now, what is the rate-limiting enzyme for heme synthesis? It is ALA synthase. The rate-limiting enzyme for heme synthesis is ALA synthase. Now let us look at this very important pathway, the metabolism of serotonin. The precursor of serotonin is the amino acid tryptophan. Tryptophan is hydroxylated into 5-hydroxytryptophan. The enzyme that catalyzes this is tryptophan hydroxylase. Now 5-hydroxytryptophan will undergo decarboxylation, and it now becomes the famous 5-HT or 5-hydroxytryptamine. This is serotonin. The enzyme that catalyzes this is 5-hydroxytryptophan decarboxylase. So serotonin is 5-hydroxytryptamine. Now let's pay attention to this pathway. So let's start off with lactose. So lactose is a disaccharide that will be converted into glucose and galactose, and that is through the action of the enzyme beta-galactosidase. So lactose will be broken down to yield galactose and glucose, and the enzyme that catalyzes this reaction is beta-galactosidase. Now your clinical pearl is beta-galactosidase deficiency is seen in patients with Krabs disease. Now, what are your ketone bodies? We have acetone, acetoacetate, and hydroxybutyric acid. So your ketone bodies is acetone, acetoacetate, and hydroxybutyric acid. Now, lipoprotein lipase is also known as the clearing factor. The absence of this enzyme, lipoprotein lipase, leads to the condition known as Friedrichson's type 1 hyperlipoproteinemia F. So the absence of lipoprotein lipase leads to Friedrichson's type 1 hyperlipoproteinemia. Now the disease, CGD or chronic granulomatous disease, results from a deficiency of what enzyme? It is NADH oxidase. So patients with CGD or chronic granulomatous disease will lack the respiratory burst or the oxidative burst. They will present with defective neutrophils and defective phagocytosis, hence predisposing them to recurrent pyogenic infections. Now, Smith-Lemli-Opitz syndrome. This is commonly known as SLOS. This results from a deficiency in the enzyme 7-dehydrocholesterol reductase, or DHCR. DHCR, 7-dehydrocholesterol reductase deficiency, leads to Smith-Lemli-Opitz syndrome. Smith-Lemli-Opitz syndrome can present with mental retardation, syndactyly. So Smith-Lemli-Opitz syndrome. Now look at this figure, which is lifted from your Robbins, showing you the lumen of the blood vessel, the lipid core, and the fibrous cap. Now always remember, clinically, signs of angina arise when the lumen of the coronary vessels is occluded at least 75% or more. So we are now going to differentiate which of these blood vessels is stable and which is vulnerable. So as you can see, an atherosclerotic plaque with a thick fibrous cap and a thin lipid core, this is considered to be stable. The one on the left has a very thin fibrous cap and a thick lipid core. This is the vulnerable plaque. So vulnerable plaques have a thin fibrous cap, large lipid core, and greater inflammation. Vulnerable plaques have thin fibrous caps, large lipid cores, and greater inflammation. Now, what is the thinnest part of the lateral wall of the skull? It's the pterion. So the pterion is the thinnest part of the lateral wall of the skull. Now, what structure lies underneath the pterion? It's the anterior branch of the middle meningeal artery, your AMA. So if you have a fracture of the pterion, this would injure or rupture the middle meningeal artery, thus leading to an epidural hematoma. Now, this is a scan showing you a subarachnoid hemorrhage. This hyperdensity, this is the subarachnoid hemorrhage. Now, what is the most common cause of subarachnoid hemorrhage? It is trauma. Now, what is the most common cause of a spontaneous subarachnoid hemorrhage? It is a ruptured berry aneurysm. A ruptured berry aneurysm. The most common location of a cerebral aneurysm is the anterior communicating artery. The anterior communicating artery, or the ACOM. Now, assignment, please read on your 3 types of Le Fort fractures, from Le Fort 1, Le Fort 2, Le Fort 3. Don't forget, your Le Fort 1 is also known as a horizontal fracture. A horizontal fracture, also known as your Guerin type fracture. Le Fort 2, this is known as your pyramidal fracture. So please take time to read on the different types of Le Fort fractures. Now, lifted from your Swartz, what is the most common site of a mandibular fracture? At 36%, it is the condylar process. The most common site of a mandibular fracture, the condylar process. Now, what is the most common facial bone that is fractured? It's the nasal bone. Now, here's a picture of a cleft lip and cleft palate. Let's go over the rule of tens. So the rule of tens applies for primary cleft lip repair or cheiloplasty. So this is the rule of tens. The baby should at least be 10 weeks of age, 10 pounds in weight, and with a hemoglobin of at least 10 grams. Now, where is Broca's area? It is located in the inferior frontal gyrus. This corresponds to Brodmann's area 44 and 45. So Broca's area is located in the inferior frontal gyrus. It corresponds to Brodmann's areas 44 and 45. Now, what about Wernicke's area? This corresponds to Brodmann's area 22. This is found in the superior temporal gyrus. So this is found in the superior temporal gyrus. Now, what is Horner syndrome? This is PAM, ptosis, anhydrosis, and meiosis. So Horner syndrome is ptosis, anhydrosis, and meiosis. Horner's syndrome can be encountered in patients with a superior sulcus tumor or an apical lung tumor, or what we call a PENTOSE tumor. Now, what is impinged in Nutcracker syndrome? Now, in Nutcracker syndrome, there's two blood vessels you have to take note of. That is the superior mesenteric artery and the aorta. So the superior mesenteric artery and the aorta. So if you look closely, the aorta is here and the SMA is here. The structure that is impinged or compressed is the renal vein. So what structure is impinged in Nutcracker syndrome? It is your left renal vein. So here's the SMA normal aorta, and the normal left renal vein. So when it's impinged, like here, looks like a nutcracker. Hence the term Nutcracker syndrome. Now this is the adrenal glands. We have here the cortex, and we have the inner medulla. Now the cortex produces the steroid hormones, while the medulla produces the catecholamines. So in the cortex, we have the zona glomerulosa, the zona fasciculata, and the zona reticularis. The zona glomerulosa produces aldosterone, while the zona fasciculata produces your cortisol. So aldosterone is produced by the zona glomerulosa. Cortisol is produced by the zona fasciculata. So I want to end with this case for this set, and we'll be giving you access to more sets of flashcards. You have a patient with meningococcemia, adrenal crisis, or shock. So don't forget purpura fulminans. So you have a patient here with fibrin in the circulation, or DIC. It is your Waterhouse Friedrichsson syndrome. Very high mortality within 24 to 48 hours. So I hope you've learned something in this set of flashcards. Please take time to repeat them as you please during the access period, and I hope you will enjoy the other ECDB flashcard final coaching. This is Dr. Toom. Thank you and God bless.